So your username is going to be H Zhang. Doesn't have to be capitals. This is cloud-based software, so you can log in on any computer. I didn't download anything here. Just save that to your favorites, and then you can use any computer.
Sure. And,
all right. And the password's 123. Yeah. And now you gotta change it 8 characters, at least 1 capital.
8 characters. Okay.
Yeah, 1 capital. Yeah.
1 capital, right?
Yeah. And if you forget it, you can have them send it to you, and it'll go to that email you gave me. If you get locked out. Okay, so now this is where you're gonna go, just, X out of that, that's fine. Yeah, that's fine. This is where you're gonna go to start all the studies. This is where all the reports are gonna go. This is pretty much where you're gonna do everything. So it's pretty straightforward. You're gonna go, first thing you can do is you're gonna go to add patient. First you add the patient, then you add the study. If it has a red asterisk, make sure you put it in. Put like test 2, because I already did test 1. There you go, fine. If it has the red asterisk, make sure you do it. The medical center is going to come up automatically. Yeah, perfect, perfect. If you know that the patient's in AFib, click that off over there. If you don't know, then don't worry about it. Make sure you use the patient's cell phone there. Because if we have any reason to contact the patient, we want to be able to reach them on their cell phone. Don't worry about the insurance information because you're not using us for billing. Now, if they're elderly and they have a caretaker, put the caretaker's name and phone number there. And then lastly, we can text them in 4 different languages. So click on that. Perfect. And then hit save. You got it. Now we're going to go to add study. You know? Now, these are basically 5-day studies. They're called mobile cardiac telemetry. So the difference between this one and the Holter is this one, we're seeing the data as the patient's wearing it. So if there's anything serious going on while the patient's wearing it, we can call Dr. Aslam and let him know and say, hey, go to the emergency room, go to the doctor tomorrow morning. We can change your medicine, things of that nature. But we're always going to do MCT, okay? So just leave that as MCT. You can do the Holter as well, but you always want to do the MCT. You got it. Once you choose the patient's name, the provider will automatically come up. Perfect, perfect, perfect. Okay, so now choose phone IMEI. This is like your serial number. So you have 2 phones, but you can only have 1 test going on at a time. Only 1 at a time. If you need to do more than 1, then we'll talk to Dr. Aslam and he can let us know. But really you're doing this test for Fidelis patients because they don't pay for the Holter. And you're also doing it for Medicare patients because with Medicare it pays more than the Holter. But let Dr. Aslam tell you, or his assistant or his fellow doctor tell you, which test they want you to do. But really, we're still diagnosing arrhythmias. It's pretty much the same indications. Okay, so now to get the IMEI number, it's in a million different places. But I usually look at the last couple of numbers on the phone. So just pick, since you picked that one, see where it says 0569, 0569. You got it. Now to start it, just hit now. No, just hit now. Go back in there. See 0569, you did it. Perfect. You want to change it to the other one, you change it to the other one. When it's being used, it's not going to show up there. So it's only there when it's not being used. Now here, click on that box, just hit now. Yep. And then get out of there. You can hit done or get out. Perfect. And then here, he always does 5-day studies. So you're going to change that to 5. And then hit save. Now you've started everything on here. You've done everything properly on here. If you click refresh, you'll see it pop up. Perfect. So now we've started on here. Now what I like to do is, and this is really important, remember one thing and one thing only today, you only want to have 1 phone and 1 patch on at a time because they connect to each other. And if you have multiple patches and multiple phones on, they may connect to the wrong one. So do yourself a favor, when you're doing it, always have the phone, only 1 phone on. So what I like to do is I actually like to turn the phone on first, only because it takes like a couple minutes to download all the settings. That way, while you're doing this, you're not waiting for that. So just hold that on like a regular Android. Just hold it till you feel it vibrate. There you go. Just let it go. Perfect. You can let go now. Let go. Yep, it's turning on. Just give it a couple minutes. Okay, so the first step, we started the study here. The next step is you have to pair this patch This is a wireless, waterproof, disposable patch. So the patient just throw this out when they're done. Usually what most doctors do is they tell them to bring it back. That way they bring the phone back. If you tell them this is garbage, then they take forever to bring the phone back. And the whole reason I give you 2 phones is so that you don't have to wait for the first patient to bring it back to start another study. Does that make sense? So I'll open it for you. So you're gonna open this up. And you can call me anytime.
Okay.
Come on, why is it going dark so quick? I don't like this one.
Let me see.
No, it's all right. Let's down low. But
Okay.
It seems like it was going dark quick. Give it a second. That's why I like to turn it on first, though. So you don't have to sit here and wait for this.
So using this one to pair it?
Yep, that's gonna go. That's what the patient wears. This is they just carry it with them when they're home. You just tell them leave that phone on and charging anywhere in your house or your apartment. When you go out, take it with you. But all they have to do with the phone is to make sure it's on, charging it on. They don't have to do anything with it except make sure it's on.
Also, they need to take this phone anywhere?
Yeah, when they go outside, take it with them.
Oh, okay.
When they're home, just leave it home. Just leave it plugged in somewhere in the kitchen or on their nightstand and make sure it's charging. The way it works is the data goes from here to the phone to my 24/7 monitoring center in Houston. So that works on hotspot. It connects to that via hotspot, and then it sends the data via cellular. It's really, really, really important, just like you do with the Holter, to make sure you do a good prep on the patients. So if the men, good thing Chinese men don't have a lot of hair, but if they do, shave their chest, wipe it with an alcohol prep pad, and then dry it with a 2x2. For the women, just make sure you get the oils off the skin, you know, with an alcohol prep pad, and then dry it with like a 2x2. Now what you're gonna do is, this is our app. That protects the phone, you don't, so the patients can't go in and make phone calls and send internet and do texts and things like that. So what you're gonna do is you're gonna click on the app. Yep. Take a guess. Look how smart you are. Yeah, hit it.
This one?
Hit it. Yeah. Now you're gonna turn the patch on. The way you turn the patch on, you just press that one time. Yep, now you can let it go. See how it's blinking green quickly? That means it hasn't paired, it hasn't connected to the phone. In a second, you're gonna see it start to blink green slowly, and then you'll see those 5 letters pop up over there. Now you wanna make sure that they're the same 5 letters here, there. Once you see them, go ahead and connect it. Go ahead and tap it. Now just tap it right on the letters. Yep. Now hit connect. Now you're gonna wait for this red icon to turn green. Once that red icon is turned green, that tells you that it's paired, and now you can go ahead and put the patch on the patient. Now when you're putting the patch on the patient, this is really important. You wanna make sure you hold that patch right here on them for 2 minutes. So if it's a cute boy, you can hold it for them. If they're ugly, make them do it themselves.
Okay.
Did you catch that? That's my technical. So this is what we're gonna do. You're gonna be my guinea pig. Unless you wanna get that doctor in here. What's his name?
Hannah.
No, you Hannah. What's his name?
Mine?
What's the guy that doctor's name?
Jimmy.
Jimmy! Jimmy!
He's taking patients.
No, okay. Hold on. Yeah. Take your shirt off.
No.
Come on, Jimmy.
I got
This
you
is
patience.
important.
I wish I could.
This just take you 10 seconds.
It's okay, sir. I think we know.
I'm not getting fresh. So it's
The
really,
only
really
time I will take
important.
my shirt off if you're not in the room.
All right, fine. So it's really important that it goes right there, not with your hair, and then you can either hold it for the patient or you hold it for him. So I want you to hold it. I want you to hold those 4 electrodes. So those 4 like things right there, yep, that's what I want you to hold for 2 minutes. Now as you're doing that, oh, you have the phone. No, you have your phone. Where's the phone? As you're doing that, you're gonna see the EKG start to come across the screen, okay? Once it settles down, make sure 2 minutes, that's the most important thing. Clean it in 2 minutes, okay? Once it settles down like it is now, you hit proceed. Then it's saying, do you want to erase the old data in case there's any data left on it from the last patient? Always hit erase, okay? And now it's gonna check to try and connect to my 24/7 monitoring center. As long as there's good internet here, it's gonna connect. If there isn't good, it may not connect until the patient walks out the door. But it looks like it's pretty good. So in a second, you're gonna see that's gonna connect to my monitoring center, and then you can let the patient go, I hope. Don't let me down. Why are you letting me down? Okay. First, you're going to see that connecting one change to green. Then you're going to see the leads one change to green. That not transmitting, that may take 5 minutes or so. You don't have to wait for that. See green? Green? Okay. Now you're good. Now, keep holding. Now, some doctors do this, but you don't have to. If the patient's feeling something like palpitations, chest pain, you can teach them how to trigger a symptom. Now remember, it's picking up everything anyway. If you think this is going to overwhelm them, don't even teach them this. So this is just like if they're younger and they're maybe a little tech savvy when you want. The way you trigger a symptom is you just click, you go from the main screen, you just click on the app, hit add symptom. Oh, dizzy, heart racing, sweating, you know, while exercising. And then record it in. That's all they have to do. But you don't have to do that. It's picking it up anyway. All right, now, the last thing is you want to make sure there's a green check mark next to that serial number. If there's a green check mark there, that means you know you did everything properly. Go ahead, hit refresh. And that's it. Now you know everything's working properly. From here on out, it's really up to my team to make sure that it transmits for the whole 5 days. If there's any issues, we'll contact the patient via text. We don't speak Chinese, so if they only speak Chinese and they don't reply to the text, I may have to call you and have you call the patient. But we'll try and do it ourselves first. Okay, via the texting, which is in Chinese, Mandarin.
Sure,
I think it's Mandarin.
I got it.
All right. And that's pretty much it. The doctor does everything else, right? The reports are all in here, but that's Dr. Razum will do that. You know, all the data's in here. Like I said, it's about 5 minutes behind, so you're not going to see anything yet. But if you were bored and you on a Friday night, you know, and you want to come and look at EKG data, it's all going to be in here. Again, it takes about 5 minutes, so it's not there yet. But if you want to check in 5-10 minutes, you click on full disclosure, it'll be there. Do you have any patients coming in today for this?
I will ask someone to call the patients.
All right, this is what I want you to do. Keep wearing this, but if you get a patient, you need to end your study. Once you end the study, you can rip that off and throw it in the garbage. The way you're gonna end it early, because we did it for 5 days, but since it's just you, we can end it early. All you gotta do is click on that and hit end study, and then hit end study. So I'm gonna let it go for now, but if you need to use this license, you're gonna have to end your study first. Okay, because you can only have one study going on at a time.
Okay, so I can end it right now.
No, don't end it. Wear it until the patient comes in. Let's see. Let's make sure you're healthy.
I'm healthy.
You don't want to know?
Yeah.
Nobody wants to know. Just keep wearing it.
Okay.
Keep it within 20 feet of you. Keep this within 20 feet of you. Not there yet, I'm telling you.
5 minutes. Okay. Okay, I got it. So
It's pretty easy.
if the patient
Call me. You know how to reach me? You have my cell phone? You have it in your phone?
No, not in my phone. I think in the
You want to put? You want me to? Let me.
Sure. Let me see.